And it is 7:01. The recording has started. We will be posting this on the United Poodle Association website, as well as our Facebook page for the public. So tonight we have a discussion on MVD, also known as hepatic microvascular dysplasia. And we have Karen Pingle, who has really dove into this issue and the genetics, and she is going to share her knowledge and experience with us as miniature poodles are in the affected group of dogs. So thank you for your time, Karen. We really appreciate this. There's also an article that I wrote to supplement this, and that is posted in the UPA education page. All right, Karen, it's all yours.
All right, thank you so much. And for those who do not know me, my name, again, is Karen Pingle. I'm actually a speech language pathologist by trade. My husband, Ryan, is here with me as well. But as far as the dog world goes, we have been in the American Hairless Terrier breed since 1999, and we are currently now the longest active breeders in our breed, if you can imagine. I have been president of the Hurricane Alley American Hairless Terrier Association, which is a UKC club. Ryan is vice president of the American Hairless Terrier Club of America, our AKC club. And really, this breed is super near and dear to our heart. And you'll see from our experience that making sure that we all do the best we possibly can when we are making breeding decisions is of utmost importance. So I do want to thank Michelle Harvey and Gloria Ogdahl from the United Poodle Association for giving me the chance to share my knowledge and, hopefully help some others out there with something that, as Michelle said, unfortunately, we know a lot about this disease. So we are not vets and we do not play one on TV. But we certainly have done lots of research and have now more than a decade worth of experience regarding this disease. So while I'm talking, though, I want you all to feel free to ask questions if you have them, if something doesn't make sense, if you need more information. I will certainly do my best to try to explain. So without further ado, let's talk a little bit about normal digestion in the liver. We all know that foods are digested in the intestines and they're absorbed into the portal bloodstream and they're carried to the liver. So the liver itself has a few primary functions. Its main job is to filter out toxins, to manufacture or store sugar for energy, processing drugs and chemicals, and to make proteins. And so when you think about drugs and chemicals, and this will come up a little more when we're talking about our personal experience, we give our dogs heartworm medication, other medication that your dogs may be on. Knowing what's the status of your dog's liver is certainly important for that. Or if your dog is going to undergo anesthesia, pre-anesthetic blood work is of utmost importance. If the dog's liver is not functioning properly, the liver may not be able to filter out those chemicals. And of course, when toxins are not removed, they will build up in the bloodstream or the kidneys. And that's when you start to see symptoms in your dog. So a brief overview of portosystemic shunts. So there are two primary researchers in this area. So Dr. Karen Tobias and Dr. Sharon Center are the two individuals who have done the most research in this area and really have published quite a few papers. So as Michelle mentioned, she put an article up. It has a lot of lovely references. Also at the end of this talk, there are other references that you can go to as well. Really helps to explain the continuum of the disease, because this is truly a continuum. People think, oh, well, my dog doesn't have a shunt. Well, PSS, portosystemic shunt, and microvascular dysplasia are truly on the same continuum. So hopefully we're all familiar with, say, patella luxation, right? So you have a patella luxation that's a grade 1, a 2, a 3, or a 4. Of course, you can have a 0, no luxating patella at all. But if you think about that continuum, a dog with a grade 1 patella is not going to nearly be as affected as a dog with a grade 4. So if you sort of think about this liver disease continuum, and portosystemic shunt is then like a patella grade 4, whereas MVD is closer to a grade 1. So in some dogs, it might cause an issue, and others it will not. So when you have an actual shunt, there's a large blood vessel in the abdomen that is enabling venous blood, so the dirty blood that would normally go from the intestines to the liver, to partially bypass it. So if the blood does not go into the liver to be cleaned, then you have those toxins and so forth in the body. And this can be congenital, so meaning it can be from birth, or it can be acquired due to severe liver disease. For example, if there's cirrhosis of the liver. Sometimes if there's severe infections and the liver itself gets severely damaged, you can have other blood vessel issues as well. So again, same continuum, this portosystemic shunt versus microvascular dysplasia, and they are both related genetic disorders per Dr. Center that cause malformation of the liver circulation. So this is a genetic disorder. We'll talk more about the genetics because of that, because of course that's where we as breeders or potential breeders can certainly have an impact in our breed's health. But so shunts are typically those large blood vessel disruptions, whereas MVD truly occurs at the microscopic level. So sometimes in our breed, this has been a sticking point. Well, my dog doesn't have it because when my dog was spayed, the vet looked at the liver and the liver looked good. Well, that's nice, but unfortunately, you cannot see microvascular dysplasia by visual inspection of the liver. When I say microscopic, it's microscopic. So this is not a big blood vessel thing. This is teeny tiny lack of differentiation. So you know we have arteries and we have veins. They are not supposed to mix, right? So if your arteries and veins are not fully separated and they are mixing blood at the microscopic level, that's what it's like when your dog has MVD. And MVD can co-occur with other shunts. So you can have a portosystemic shunt and you can have MVD at the same time. However, more often it occurs in dogs without shunt or even clinical signs of illness. And we'll talk more about that. And of course, that is also referred to as congenital portal vein hypoplasia. You'll find in the literature and in Michelle's article, you'll see this also. There's a lot of different names for the same issue. So you'll hear microvascular dysplasia or MVD or hepatoportal MVD or HMVD or HMD or primary congenital portal vein hypoplasia. It's a lot of letters. It's a lot of things. It all means the same stuff, that the liver is not functioning ideally because those blood vessels are not normal and therefore the liver is not functioning at its most efficient. So whether blood is diverted all the way around the liver, like a shunt, or the microscopic vessels in the liver are underdeveloped or absent, then the liver cannot function efficiently. So again, drugs and toxins are not cleared and the liver itself lacks the building blocks for growth or repair. So you can see things like side effects from excretion of excess ammonia in the urine. You can also see symptoms like this. So typically when you read the literature, particularly, there are a lot of breeds that the prevalence rate is as high as 80%. 80% of some of the breeds out there have MVD. So it's not something that can be eradicated completely, because you'll see like general size, small size, hypoglycemia, which can cause neurological signs, failure to grow, poor muscle development, poor coat. Let's talk just for a minute about small size. How many breeds out there do we have? Oh, let's make a teacup version, or let's make a teeny tiny whatever, or oh my gosh, this puppy was born and it's so perfect, but it's teeny tiny. It's like in miniature. Oh my gosh, I want to keep that and I'm going to breed that. Well, oftentimes, particularly in these smaller breeds, the reason that puppy is small is because it has a liver issue. Yorkies, this is a huge issue in Yorkies, and at one point it was as high as 80%. The Yorkie breeders have worked really hard to try to get that percentage down. but this happened a lot in the Yorkies. The puppy was super cute, and so the breeders would keep it, unknowingly selecting for MVD, right? So those are general signs. You may also see, my puppy doesn't want to eat. It's, sometimes it eats, sometimes it doesn't, sometimes it, eats a lot, other times it's just sort of picky. Maybe they seem nauseous or drooling. You might have intermittent vomiting or diarrhea, weight loss. These puppies, a lot of people will say, I have to keep changing food because I give them this one food and they eat it really well for a while, and then they stop eating it. And then I give them something else and it seems to do well. The theory with that perhaps is of course, if we ate one thing and one thing all of the time, we would have imbalances. So perhaps with different dog foods, if there winds up being toxins or particular ingredients, copper is a big one that the animal is unable to filter out in the liver. Changing the dog food can improve the dog's symptoms. So the person thinks, oh, my dog is feeling much better, but then it just sort of swings around again, because then that particular food starts to build up in the dog's system, and then you have to do more modifications. You may also see urinary issues like UTIs, specific crystals and stones that are exclusive to dogs that have liver issues. So the ammonium biurate crystals or the urate stones. You may also find urinary obstructions, excessive thirst, and urination. But I don't want you all to think that if your dog has a UTI, it has a liver problem. Of course, that's crazy talk. Dogs can certainly have other reasons for excessive thirst and urination. We have one first time ever with a prostate issue, and that was his presenting symptoms. He does not have a liver issue. He's 11 at this point. So these symptoms can also be a bit confusing, right? Because so far these are pretty generic-y symptoms, right? They can be found in many other problems, not just a liver issue. Neurologic things, behavior changes, lethargy, aggressiveness. The dog might seem less intelligent, or maybe looks like the dog has dementia. The dog might pace or circle or have tremors. The dogs may also go blind, have seizures, and in the most severe cases, of course, you have coma and death. There are a few other things that are very obvious signs of liver issues, which of course are jaundice, so the yellowing of the whites of the eye, and or you can see it where the gums sort of turn yellow. And in our hairless breed, the skin itself might have a yellow hue. Ascites, so fluid buildup in the abdomen, and bleeding problems. Typically, those things are not found in MVD, but again, rather in the shunted, larger blood vessel issues. So one of the things that makes this all super fun and really difficult or challenging for pet owners particularly is some of these dogs are completely asymptomatic, and that's awesome, right? Have no problems at all. They also, you can find that it varies from animal to animal. So animals with similar serum bile acid results, and we'll talk more about what that is in a bit, one of them may be perfectly normal, asymptomatic, and one of them may have a ton of symptoms. Not only does it vary from animal to animal, but it can vary from day to day. Sometimes it worsens after eating. So again, if you are trying to digest your food properly and your liver is not working, it makes sense that you're not going to feel well after you eat if your liver is having a hard time with the processing of the food. It can also change as your animal gets older. And also the diet you are feeding, as well as any medications the animal is on, can certainly impact symptoms along the way. So what does one do? So when you are talking about comprehensive liver evaluations, of course, you always start with blood work. So CBC, the Chem7, so this regular blood work, diagnostic blood work, where they are looking at often liver enzyme function and those things. But if you are talking about MVD, typically those things are completely normal. The only test blood work wise that will show microvascular dysplasia is serum bile acids. And again, we'll talk more about that specifically. Some will do urine analysis. You can do abdominal x-rays. If you have a portosystemic shunt, you might find that the liver itself is smaller than would be anticipated for the animal's size, but an X-ray is not going to be helpful for MVD. Not only can you not see that kind of microvascular issue on an X-ray, you also can't use an abdominal X-ray to visualize the urate bladder stones, but you can do ultrasound to do urate bladder stones, and ultrasound will also help to diagnose portosystemic shunt. It is not going to help with microvascular dysplasia diagnosis either. You can do advanced imaging, CT, MRI. Those will certainly be helpful in diagnosing this. And then, of course, you have a biopsy. And Dr. Center recommends a 3-lobe liver biopsy. The liver has 4 lobes, and you are going to avoid the caudate lobe because that skews data because of the attenuated blood flow that's there. It receives the first branch of the portal vein. So biopsying that particular section of the liver is not going to give you extra information. So when this first started coming up in our puppies, I tried to do as much research as possible. And as I mentioned earlier, Dr. Sharon Center was super helpful via email and phone. And some of the things that she was working on was the genetic information. And this is a super difficult thing, you know, with some of the genetic disorders, PLL, PRA, you just do a simple swab of your dog's mouth, you send it off to whatever genetic lab you're using, you get the results, your dog is clear, your dog's a carrier, your dog's affected. You know those things. It's very simple to avoid breeding to dogs that have those kinds of genetic issues. Unfortunately, MVD is not like that. It is a polygenetic trait, and she has mapped it, or she had at that point, in 8 different breeds. The breeds that she has the most current SNP platform, so it's a genetic test, and she can use that to tell those specific breeds like who to breed to in a particular line. The haplotypes in each breed are different, so you cannot use info from one breed and generalize it to another. So she was working with Yorkies and Havanese, you know, very in detail, you know, in quite a lot of intensity. Maltese also were some of the breeds, and you can see some of the prevalence rates there. So 80% prevalence rate in Maltese, Yorkies, and Havanese. So the rate is lower now because the breeders have been doing a good job to try to avoid breeding dogs that are affected. The Cairn Terrier, the Tibetan Terrier, 1/3 of those dogs are affected as well. It really is a small dog disease, and that MVD itself changes the receptor response, so that contributes to that height and size development. So Ryan and I have historically, I don't want to say panic, but I literally shake. So we take all of our puppies in for testing, and anybody that's on the smaller side, I always get super nervous that their SBA is going to come back bad. And I close my eyes and I click on the link, and when the thing comes up, I'm like, ah, hoping that the puppy is okay. So Dr. Center is the one who developed the serum bile acid test. She is the one who did all of the research. She is the one who determined how you do it. So her procedure is at age 16 weeks. That is the earliest the test can be done reliably, but we'll talk a little bit about some other options that other researchers have talked about. But what we have done is we've adopted Dr. Center's process. So at age 16 weeks, all of our puppies are tested. We ask the new owners to do this as well. Your dog has to be fasted for at least 8 hours. Your vet then does a pre-prandial. So the word prandial means meal. So before the dog eats, they're having a blood draw. And of course, the blood draw itself, it is simply a serum bile acid test. The dog eats Science Diet AD canned dog food. This is the gold standard that this test was developed on. For us, our breed, they range in size from say 16 to like 25 pounds, and they eat about half of a can during this test. You wait exactly 2 hours, not an hour and 45, not 2 hours and 30. and then you redraw the blood for the post-meal results. So bile acid is released by the liver when, or into the bloodstream by the liver when the dog is eating. And before the dog eats, there should not be a whole bunch of free-floating bile acid in the dog's bloodstream. If there is, it means the liver is not functioning properly. But if the levels are low, like a normal liver should be, then you'll have values that are in the normal range. Once the dog eats, it is normal to release the bile acid to help with the digestion process. But within 2 hours, if the liver functions properly, then the liver should have reabsorbed most, not typically all, but most of the bile acid that was free floating and released into the bloodstream. And when Dr. Center did this, she compared liver biopsies against the serum bile acid values to develop the norms. So sometimes when you do this test, the lab comes up with different numbers that they use as a norm, but literally Dr. Center tested a whole bunch of dogs, hundreds of dogs, and she literally cut them all open. So she did the serum bile acid test, she cut the dogs open, she did the 3-lobe liver biopsies. And that is how the norms were developed, by looking at the liver to determine which livers were actually normal when the biopsies were done. So this is what Dr. Center found. So pre-prandial, so again, before meal, your dog should not have any higher value than 10. It should be under 10 if your dog has a normal functioning liver. After you eat, the dog should have a number 14.9 or lower to be considered normal. An equivocal dog is a dog in the 15 to 24.9 range. And equivocal means that 50% of the dogs that Dr. Center biopsied had MVD, but 50% of those dogs in that equivocal range had normal livers. So equivocal is kind of like a crapshoot, right? So you don't know whether the dog is normal or not. But if the result is over 25, that liver functions improperly. That dog should never be bred. There's not an option to consider, oh, well, I should breed because whatever. Dr. Center did not ever recommend breeding the abnormal dog. So anything over 25 should not be bred. And then anything that's greater than 100 actually suggests presence of a shunt. So significantly worse, obviously, than MVD. So with those equivocal dogs, let me say that over here. So with the equivocal dogs, she recommends, Dr. Center recommends, you can breed an equivocal dog to a normal. Normal can always be bred to normal. And unfortunately, can you get abnormal when you breed normal to normal? Yes, you can. So remember, it's polygenetic. So just because the sire has a normal liver and the dam has a normal liver does not guarantee you 100% normal livers. But it's way better than breeding abnormal. You breed abnormal, you get abnormal. That is guaranteed. If you breed equivocal to equivocal, you're going to get a bunch of abnormals. You'll get some equivocals, which you won't know whether they're good or bad until later, retesting, or the dog becomes symptomatic. Or, of course, you'll have the normals. So breeding normal to normal is obviously the thing that makes the most sense. But if you have a dog that is testing equivocal, and what we do if we have an equivocal is we will retest to see what we get, just to sort of see. Most oftentimes when we retest, the dogs wind up in the abnormal range, but not always. So if you test the equivocal and you get equivocal consistently, certainly up to you. Dr. Center says you cannot throw away all of the dogs in a breed, particularly our breed, which has a genetic diversity. Actually, according to the UC Davis study that we did, our genetic diversity is actually one of the top genetic diversity out there. It was funny because I actually wanted to do the study as a way to continue to be able to outcross to rat terriers to improve genetic diversity, because I was, really concerned that we were starting to bottleneck some. And I was the most shocked of all to find that our genetic diversity is literally like in the top 5 of all breeds out there. So we have done a good job with genetic diversity. But if you have a specific dog that has a lot of meaning to you and you really want to continue this line and that dog is equivocal, you can certainly breed that dog. But again, you would want to be breeding to a normal in an ideal world. So unlike Dr. Center, Dr. Tobias, who really is very well known in the Yorkie world, she started recommending that the Yorkie breeders test at 8 weeks of age. And if at 8 weeks the dog is already abnormal, then you know that puppy is abnormal. But she recommends normal dogs still be retested at 12 weeks or older. But because congenital PSS or MVD are so common in Yorkies, that she also recommends that they be retested at 4 to 6 months of age for evidence of liver dysfunction. So based on this, my club has started offering AHT breeders, if they test their puppies at 8 weeks, anybody whose puppy owners will then retest later after 16 weeks, my club will pay for their test. So they have the test, I ask them to submit the bill, and I pay the vet directly, and the people get a credit because I want them to report the results. I want to see if we can figure this out earlier, because no breeder wants to keep the puppies till 16 weeks. And once the puppies are gone, it's hard to have the pet owners, complete the testing. Some are very good, but it can be a challenge. So if we can find that 8 weeks winds up being as reliable as 16 weeks, that would certainly be helpful. So anything that's in yellow comes from Dr. Tobias's quotes that I took from her VetMed article, but the other information came from the email and phone conversations that I had with Dr. Sharon Center. So results can vary some within the ranges. Dr. Center was very quick to point out that a dog with a postprandial 1 is not significantly better or healthier than a dog with a postprandial of a 13. The way that our minds work with numbers, we think, ooh, a 13 is close to equivocal, so a 1 is better. No, anything that's 14.9 and under is great. They are fine. And 100% of the time when she biopsied those dogs' livers, they were perfectly normal. And there's no like Superman liver, right? So the liver was either good or it wasn't, right? So 14.9 and under, fine. And results will vary within the range. Normal dogs can test equivocal, but will never test abnormal. I will say that again, because this comes up quite a bit in our breed. A normal dog will test equivocal sometimes, depending on what you feed, depending on other situations. But a normal dog is never going to test abnormal. So if you've done your dog's test and you wind up with, let's say, a 17, and you think, I'm gonna retest, and you retest and you wind up with a 40, your dog is abnormal. The dog is not normal, and you can't say, well, I had an equivocal result, and therefore my dog's liver is okay. No, equivocal, again, 50% are okay, but 50% are not okay. So you are not going to expect a normal dog to have high bile acids. A normal liver can remove the bile acids from the bloodstream. So again, you are not going to see high numbers if your liver functions normally. Again, you have an abnormal result, your dog is abnormal, and you should not breed that dog. Unfortunately, in our breed, people do. It blows my mind. But of course, they personally have not had the experience that we have had, which I would hope would change their behavior. I'm not sure. Ryan, is that a message to me? Okay.
That was a message to anyone that wants to share the link. In the upper left-hand corner is the meeting information. If they click on that shield, it'll show the link and they can copy it and share it. Done.
Okay. So some information, some Sometimes people will say to me, well, the serum bile acid test is imperfect. 100% agree. I don't know that there is a perfect test out there for a polygenetic anything, but it is a tool. It is a tool that we use to help us make good decisions, to help us improve our breeds, to help us produce puppies that will be healthy and live long, long lives for the people that love them, right? I mean, that's the goal, right? We are trying to preserve and improve our respective breeds. And of course, there are dogs that we will keep to go forward with, dogs that we will send to other breeders and fanciers to help continue the breed. But a lot of our dogs go to pet people, right? And they need to be loved in these pet homes, and they need to be healthy. We do not want dogs dying at age 5 or age 6. We want dogs dying at 15, 16, 17. Heck, we don't want dogs dying at all, but we know dogs are going to die, but we want them to make it into their teens, not die when they are still very young. And one of the things people say to me, oh, is if you substitute the food, that you will have different results. And that is true. Both Dr. Sharon Center and Dr. Tobias, you'll find information in there that they will say that food itself will impact results a little, but it is not going to make a normal dog abnormal or vice versa. Raw food, because of the high protein level, can increase the value of the serum bile acid test a few points. So it might push the dog into the equivocal range, but it is never going to push the dog into abnormal. Dr. Tobias, one of her quotes in one of her papers is, owners cannot blame high bile acids on the type of meal used. This is a huge complaint that I hear all the time. Well, it was high because my dog smelled a French fry. No, it's high because your dog has abnormal liver. So we wanted to see how food impacted things. So we took one of our puppies. She was 16 weeks, and we tested with a different food every 2 days. Poor Vipe. So raw, which is her normal diet, came back at 21.8. So that was equivocal. So kibble, which we have and we just really use as treats at home, but we fed her a meal of kibble and then we tested her and she was 10.2. So again, anything 14.9 and under was normal. And then we tested her again 2 days later with Science Diet AD. So the gold standard for the test, which her results then were 8.4, also normal. So that's why we tell everyone, feed the gold standard for the test during this. Don't play Russian roulette with the results. It costs money. And when we started doing the tests, these used to cost us about $85 a pop. They're now $130. So it costs money to do the test. So you don't want to be purposefully giving your dog an equivocal result if you can avoid it, right? So I call it a study, but it showed exactly what Dr. Tobias and Dr. Center said, that raw diets can push the dog into equivocal, but it will never push a normal dog into abnormal. And of course, here with the kibble and the Science Diet, her results were normal. Does that make sense to everybody, or anybody have any questions about that? I see Adriana says, yes, it makes sense. I see Jojo. Hi, Jojo. Okay, so important points. Does SBA confirm MVD? No, it does not. This is not a, oh my gosh, the SBA is high, my dog 100% has MVD, but it is the best tool that we have currently. Again, I put this quote in here again. We do not expect normal dogs to have high bile acids. Owners may want to blame diet change, stress, or other conditions for their dog's high bile acids, but high bile acids only occur if there is liver disease. And again, SBA within those ranges that we talked about is not correlated with the severity of the disease. So even an abnormal dog, like let's say an abnormal dog that's a 26 or an abnormal dog that's a 70, you can't assume that the 70 is going to have symptoms, whereas the 26 will not. Oops, lost my cursor. Okay, so why do we know all of this? It's not because we wanted to. It is because we produced a litter with Perry and Evil, and we had litter mates, Sky and Riley, who were in the same home. Riley was actually pick bitch that we had kept but she wasn't turning out as we wanted. And Sky's mom said, oh, well, I would love to have her. So she did not get to go live with Sky. They weren't placed as puppies together. But Sky had her spay planned in October of 2011, and they did the pre-anesthetic blood work, and her liver enzymes were high. Her ALTs were in the 500s, whereas 118 is the high end of normal, and her SBA postprandial was 48. So at this point, the vet said, okay, she can't be spayed. It's not safe to spay her. The liver is not going to process the anesthesia well. So we'll put her on antibiotics, have you modify her diet. We'll do liver promoting medication like Denamarin, delayed her spay. They also found crystals in her urine that started to develop, and her enzymes, her liver enzymes normalized in January of 2013. So she was then able to be spayed in February of 2013. And during the spay, the vet recommended the 3-lobe liver biopsy. And although the liver looked normal to visual inspection, of course, SBA was bad, and the 3-lobe liver biopsy confirmed the presence of MVD. So her sister Riley went to live with Sky in June of 2012. Her pre-anesthetic blood work in January of 2013 revealed elevated liver enzymes. You can see ALT was only 180 compared to her sister's in the 500s. The treatment, of course, same thing. Spay was delayed. In the next month, ALT was in the 180s and SBA was 83. She was successfully spayed in February, and then she also had a 3-lobe liver biopsy, which also confirmed that she had microvascular dysplasia. So we began testing all of our dogs in March of 2013 because, of course, Riley and Sky's mom contacted us. She provided us with all of the documentation. We had never heard of this. This had not been talked about in our breed at all. And in all honesty, when we started talking about it in our breed, we became pariahs, and people said it's only in the Pingle dogs. It's only the Pingles did this. It was honestly, it was crazy talk. It was absolute crazy talk. But we tried to share the information. We did the best that we could, and we have continued to do this for the last 10 years. We talk about it to anybody who's willing to listen, to try to prevent what happened to us from happening to others. So we had Gavin. We kept Gavin from that litter. He did not have any liver enzyme elevations on normal blood work. His SBA pre was a 2, nice and normal, but his post was 19.6. Well, you think, oh, that's not so bad. It's equivocal, so he's okay. Well, we had bred Gavin to Sunny one time before we knew all about this liver issue. So Sunny's bile acids are there, 1.5 pre, and post was 2.8. 3/4 of the pups produced in that breeding have high serum bile acids. So normal preprandial, but elevated postprandial. So 3 out of the 4 pups were abnormal, from a normal to an equivocal breeding, right? 19.6, people tell me, oh, that's not very high. He has MVD. He has MVD from his mother. So of course, at this point, you know, we still didn't exactly know where it came from. Obviously, we knew that the peri-evil breeding did not produce healthy puppies from a liver perspective. They were pretty, but their livers were bad. So Evil in 2011, it was time for her to be spayed, and we did her pre-anesthetic blood work, and her AST and ALT values were way up. And when I say way up, like off the charts way up. We had no idea. She was a perfectly healthy, her name was Evil for a reason. She was definitely a terrier. At the time, she was the winningest AHT in the breed's history. She was stunning. She was my agility partner. She was the most amazing creature to me on the planet. Of course, I'm shocked to hear that she can't be spayed. And of course, if you look at the dates, this is, 2011. So we did not know in 2011 about Sky and Riley, right? So that was 2012 and 2013 where all of that came to light. So of course she was unsafe to spay. We treated her with antibiotics, and Sam E saw no change. We really controlled her diet and stopped her from eating poop. We thought for sure it was the poop eating. She started that icky behavior after she had her first litter of pups, but we would not let her outside in the dog yard. We would just walk her on a leash to go potty and really controlled that. So blood work actually returned to normal. She was off medication. April 2012, I came home from work. I had gone to work in the morning and my dog could see. And I came home from work and my dog was blind. She had SARS, so sudden acquired retinal degeneration syndrome. That's the diagnosis that the ophthalmologist gave. He said it's not genetic, but at the time, of course, we did not put 2 and 2 together with the liver issue. We did not know. So interestingly, with any stool ingestion, her AST and her ALT went off. We weren't sure if that was like a vitamin toxicosis. So she was eating the poop of the other dogs that might still have too much vitamins in them, or whether it was too much protein. Honestly, not sure, but she was very, very sensitive to anything that she ate. So we did further workup. We did x-ray. Of course, it was normal. Ultrasound was normal, completely normal. Her report says that her liver and her bladder and her everything, blah, 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 is absolutely perfect. I want you to look at her SBA. She was less than 1 preprandial and she was only 17.8 post. That's equivocal, right? So she was spayed in May of 2012. Visual inspection of the liver was within normal limits. I asked about biopsy. The vet said, oh, she doesn't need to be biopsied, right? And again, we didn't have Skye and Riley's information at this point, or we would have requested biopsy for sure. So in March of 2013, her ALT and AST values were sky high, like 5 times the normal limits. And she's still acting, other than being blind, she was not acting horribly abnormal. So the vet's diagnosis at that point was microvascular dysplasia, plus some inflammatory process, perhaps like hepatitis. But she was unsafe to biopsy at this point. The vet said she should not undergo anesthesia, and it certainly was not going to change the plan of care, right? So us knowing with 100% certainty that she had MVD was not going to change what we do. And let's face it, her daughters have MVD, her son has MVD, she obviously has MVD. So she's one of those equivocals that was abnormal. So here's my beautiful evil. She adjusted to her blindness. I continued to feed her liver-friendly foods and use milk thistle every day. But she declined steadily. She became incontinent at age 10. The hepatic encephalopathy. So again, we talked about like doggy, like dementia. So if your liver is not functioning well and the toxins build up, it can affect your brain. And by the age of 12, she was profoundly demented. Blind dogs that know their environment can find their way fine. So she found her way blind without any issue. But when she became demented, she could not route find, she couldn't problem solve, she couldn't even use her sense of hearing or smell. She spun in circles unless she was held. And we elected for, I always cry for this part. Kills me. She was my baby. But we elected to put her down when she was 12. I could not stand to watch this anymore, right? She and I won so many high end trials and agility. She was my special girl. I couldn't watch it anymore. I don't think she knew that she was so affected, but I knew it. I couldn't do it. So we took her in because I could not do it anymore. So Evil's offspring, right? She had 14 pups total, again, before we knew all of this crap. So 9 pups were born to Toggle. One breeding was purposeful. The other breeding was accidental. He bred her. These puppies were born more than 70 days after the breeding. That's a different story. We didn't even know, like we had no idea that he had managed to breed her. I don't have any information on Toggle, as his owner at the time would not. Yeah.
But you do know that he was gone 71 days when the puppies were born because he went to Texas from the Perry show. So
yeah, I know, but we're not talking about.
But if you say you don't know when the breeding was, but you know how many days it was, we know at least, but go ahead.
Yeah, but I mean, nobody saw it and we never would have expected it because she really wasn't in heat at the time. But anyway, of those Toggle times Evil puppies, 2 of them lived to age 14 years and were relatively healthy, but 7 of the 9 pups died when they were 5 or 6 years old. 7 of 9 of our pups died at age 5 to 6. They had stones, they had seizures, they had hepatic encephalopathy. They were all very ill, and I had to field calls from these amazing pup owners who were doing everything in their power to take care of these babies. And I gave them bad babies, right? I didn't know. I hate this, sorry, but it's when people won't do the right thing to prevent something like this from happening, it makes me crazy. So, oh, and actually I did not update this information. So Evil had been bred to Perry. As we mentioned, Riley and Sky were the first ones that were diagnosed. It says they're 12 years old currently. They are actually 13 now. They, of course, were fed liver-friendly diets and milk thistle daily. Riley died at age 6. So remember, she was the one who had lower value, well, her SBA was higher, but her ALT and so forth were lower than Sky's. But Sky and Jemmy are alive and well. Coco is alive. She now has limb tremors and she's been having some incontinence issues, but she is doing well. It says Gavin went blind 2 years ago. Gavin actually went blind 3 years ago, and he suffers from severe limb tremors, incontinence, hepatic encephalopathy, just like his mom at the time. And you'll have to remind me to update this, Ryan. So route finding was going at the time. He couldn't find us via smell or sound. He had to be carried. He eats well. He was always a good eater. He was never a picky eater. He had to take gabapentin 3 times a day to help with his pain. And I have a video here so you can see what Gavin's tremors look like. Oh, I see it's very, it's slow. I can see it on mine. It's clear. It's a lot of vibration. Let me go to the next video. So this is Gavin with his hepatic encephalopathy. Remember, when he went blind, he was able to find his way around the house, no problem. But this is the circle spinning that I described with Evil, and Gavin would spend his day doing this. If you didn't hold him, like, he could not find his way. You could call him, he could not problem solve his way out of the spinning. This was sort of new behavior for him. I don't even know what it was. These weird, like, head ticks. I think it's hard to see in the video because it's slow on your end, but like these weird little head jerking things that he was doing. You notice the dogs are checking him out, like, what in the world are you doing? I don't know if these were little seizures or what. He only did this a couple times ever, but it was odd. So why should you SBA test? So if you are breeding, remember, it's a polygenetic autosomal dominant trait with incomplete penetrance. So what does that mean? Boy, it's a very complicated issue, right? So it is dominant. So you have one dog that has a bad liver, and it's very likely, oh, Tammy's saying head throwing is what it's called. Could you see it okay on the thing? Thanks, Tammy. And yeah, so with incomplete penetrance, so it's going to inconsistently appear, right? If the dog has it, they're going to pass it to 50% of their offspring, even when bred to a normal liver dog. It is impossible to eliminate from a breed, but rather the goal is to reduce its frequency and health impact. But breeding abnormal liver dogs guarantees perpetuation of the disease. So according to Dr. Tobias, is until a genetic test is available or the trigger for the condition is determined, it would be prudent to breed only dogs with the healthiest livers. I mean, seems like common sense, right? And of course, in a restricted gene pool, which is what we thought, like the AHT, Dr. Center recommended breeding normal to normal or normal to equivocal, and avoid equivocal to equivocal, and never to breed abnormal. We talked about that already. So why else should you SBA test? What if you're not a breeder? What if you're a pet person? Well, I always tell my puppy owners that even though we only breed normal to normal, we will not breed equivocal anymore. As you can see, Evil was equivocal, Gavin was equivocal. We're gonna get serenaded by the dogs. Huh? You might wanna go talk to them. They're making a lot of noise. They can hear me, so they're thinking they should be out with me. But if you have puppies going to pet homes, right? These puppy owners need to know if their dog has an abnormal liver or not, so that they can choose appropriate liver-friendly foods, because it does go a long way in helping your dog's quality of life. I am sure if we did not know about the disease, that Gavin probably would have been one of those that died earlier than he actually did. So the feeding, you may have to do some protein restriction, and sometimes you'll read, oh, well, my dog has a bad liver, so I need to restrict all protein. No, you need to restrict certain types of protein, because they need protein or their body is going to start breaking down their muscle as fuel. So good sources for dogs with liver issues are, dairy such as yogurt, white meats and fish, eggs. These things are easier to digest, but of course the needs vary from dog to dog, and what one dog tolerates well may not work for another. Also helps to know if supplements may be beneficial. So all of our dogs, even our normal liver dogs, which thankfully now are most, we only have 2 abnormal liver dogs at this point. And one is over 15 and the other one is, I don't know, how old is she, Ryan? 6? So whether it's milk thistle, and there are some papers talking about vitamin E, K, zinc, omega-3 fatty acids, all of ours also get fish oil daily. And being careful to reduce levels of manganese and copper. There's a lot of copper, liver, like copper storage issues, and dogs that have MVD and abnormally functioning livers to begin with really tend to store copper, and then there's a whole lot of other issues that come with copper storage disease. Of course, when you are undergoing veterinary care, remember drugs are processed in the liver, so either a lagged response or a more exaggerated response can occur from anesthesia. So if your dog has MVD, notifying your vet in advance. Remember, my dog has MVD. Adriana is asking, what kind of food do you give to your dogs? We still feed raw. We feed raw even to the bad liver dogs, but we feed chicken based raw, not any of the beef. We don't feed the bad liver dogs tripe. And as I said, all of the dogs get milk thistle and a fish oil every day. And what else with the vet? So sometimes the vet can modify the drugs that they're giving and or the dosing to avoid complications. So sort of like when Gavin was in so much pain from his weird tremors and all of his discomfort, I had to ask the vet, well, what drug can I give him that will help with the pain, but will not cause, further liver toxicity issues? He had enough. We didn't need any more issues. Okay, so some closing thoughts. Serum bile acid is easy to do. Joe, I can't see your whole question. When you give the milk thistle and fish oil, right? What's the rest of the question? Or Jojo?
What is the daily dose?
I can get that to you if you want the exact information. Hang on. Okay, so the fish oil we get from bulksupplements.com. They are the omega-369 soft gels, and this is 2,400 milligrams per serving. It's just a regular human one. And the milk thistle, so when we first started doing this, I'll have to look up the capsule but I'm a big fan of bulk supplements. So this is milk thistle. So we have 12 dogs. So everybody gets a little bit in the morning, and it's literally like, you know, when you say like a pinch of salt, they get a pinch of milk thistle. I can send you the link to the milk thistle capsules that we used to use, and we used to give them a third of the capsule, like each dog a third. But this is way less expensive, and we can sort of eyeball it now, but to give you an exact amount, I'll have to look it up, but it's a good question. So yeah, so it's easy to do serum bile acid testing. You can do it when the dogs are young. And if you breed a normal to a normal, so an SBA that's less than 15 to less than 15, you have a significantly improved chance of having normal pups. In the Czech Republic, just last year, they lost an entire litter at age 5 due to liver issues. Same exact thing that we had happen with ours. So they had not been testing for serum bile acid stuff, despite our education. The breeders, a lot of breeders still say it doesn't matter and it's not important. It is important and it does matter. So it's out there, and just because you don't test doesn't mean you don't have it in your lines. It just means you haven't identified it yet. So of course we hope that everybody will do the right thing for the breed, regardless of what breed it is, and for the pup owners that are trusting you to give them a forever family member, not one who is sick and then dies a horrible death. I think there are some, there's some references here. And I think we are fortunate. I want to see if I can see so Tammy, I don't know, Tammy, if you want to say anything about your experiences. Tammy is now in American Hairless Terriers, but Tammy comes from the Yorkie world. So Tammy has also, unfortunately, lots of experience with this as well. If you don't want to comment, Tammy, you do not have to, but.
Yes, I've been dealing with, sorry, this is Tammy. Is this working?
Yes, ma'am, we can hear.
Okay. Yes, I've been dealing with this for approximately 18 years because Yorkies, when you talked about the testing of hundreds of dogs with the researchers, it was actually mostly Yorkies that they were doing. And my first Yorkie show dog that I purchased actually had a liver shunt and didn't find out till she was 9 months old. So that's when I got involved with the testing, etc. And like I said, since then I've learned a lot, and I only breed normal to a normal. I don't breed equivocals, same as the Pingles with the Yorkies. I've not bred AHTs yet, but I followed the same protocol. And I can tell you, when I first started, I had 6 Yorkies. I tested them all. 1 was normal, 4 were equivocal, 1 was abnormal. They were the equivocals and the abnormal because we have plenty of Yorkies in the, it's not like AHTs. And so I went ahead and spayed and placed and neutered those and started over. And since then, you know, because I had a lot of fading puppies, etc. Since then, over the years, I, knock on wood, in 5 years have not had anything turn up even equivocal with what I've tested, and anything that stays, even if it's my 5th, 6th generation down the line, I test all that stay. Anybody that is a new breeding male or female, they're tested, and their first 2 litters, I test the entire litter just to make sure that we're doing okay. That's basically what I do with the breeding, but everybody does differently.
Thank you for sharing that, Tammy. I don't know, Gloria, did you want to say anything, or does Gloria have any audio now or
No,
microphone capability?
she was not able to.
That is unfortunate. Gloria's experience is obviously Gloria's experience to share, so I will not give any information about that. And speaking of that, you know, I have a database with hundreds of AHT and rat terrier SBA results, and it is not my place to share. We have some people in our breed who say that I need to share the database with everyone. Well, I can tell you that the people who give me their results, they are giving me their results, and they have asked me not to share. It is not my place to give that information to other people. So we have protected that database for 10 years, and I will not give other people the results. You know, I hope one day that we'll be able to find a researcher, a vet who is interested in the information as a whole. But, and I have done in the past, I did several like pedigree searches going back 6 generations with our breed, and we were able to find some popular sires that, for example, there was a dog named Rowdy, and if your dog had 3 or more instances of Rowdy in your dog's pedigree, then that dog had MVD, like their SBA were bad 100% of the time. So, you know, and he was a very small little wiry thing. He was Evil's sire. So
And when
anyway.
Evil did well, everyone was trying to breed to Rowdy. So it made him very popular in the breed.
Yes, and unfortunately that unknowingly spread the disease throughout those lines. And of course we terminated breeding that line. I mean, that entire line, we shut it all down. Like we did not breed that at all. And the people who, we had one of our Evil puppies out there, and the person that had her, I told her not to breed that dog, and she did. And she even exported one of the puppies to another country. That puppy had abnormal serum bile acid. That boy was bred a lot. I mean, it's just amazing. Like it's so easy for it to get out of control, but it's also so easy to stop the insanity. If your dog is abnormal, don't breed it. It's very simple, but it does require you to actually test. Did anybody have any other questions?
Hi, Karen.
Oh, yes, go ahead.
This is Lisa. Thank you so much. I know this is a difficult story to tell, and I appreciate you sharing it with us. I had an interesting conversation with a standard poodle owner a little while ago. She was having a difficult time controlling seizures in her dog. And, you know, she just happened to be telling me the story at an obedience class we were in one night. And she just off the cuff mentioned that the only thing that was strange about her dog's blood work was the serum bile acid. And of course, Gloria had just talked about that in a meeting that we had for UPA. And I was like, whoa, tell me about this. So I was wondering, like, and it might vary, of course, from breed to breed and dog to dog, but how often do you see seizures in your dogs that are affected?
We fortunately have not had seizures at all. Knock on wood. We seem to have this hepatic encephalopathy, tremor, blindness, dementia thing more so than seizures. But when she says that the serum bile acid was bad, you don't happen to know if it was in the abnormal range or in the portosystemic shunt range. Because even though this is a small dog disease, but that doesn't mean that big dogs can't get it, right? Anybody can develop blood vessel problems. Not the same thing, but our beautiful daughter Corbin had a left middle cerebral artery aneurysm. We do not have aneurysms, so faulty blood vessel, like blood vessel ballooning, we don't have that in my family at all. So, but she was born that way. Like she had a congenital aneurysm that ruptured when she was 7 weeks old. So why did she have that when it doesn't run in the family? Because anytime a living creature is developing, there's always possibility that something doesn't develop correctly. Oh, she heard me talk about her. She's coming out.
Uh-oh.
Yeah, she heard me say her name. She's coming. But yes, so interesting that it's in a standard poodle. I'm hoping that her vet talked to her about modifying diet and trying to improve liver function. But it is one of the things that's just listed when you have abnormal liver, and again, those toxins build up in the dog's system. I think that the dogs went blind from the heartworm medicine. I'm not sure where everybody lives, but we live in Florida, and heartworm is a huge issue in Florida, and you must medicate your dog every month, right? We have mosquitoes year round. They don't go to sleep in the winter. I don't know. Well, today it's a little bit cooler here. It was like in the 70s, but just yesterday it was 85 again. So it doesn't matter what month it is here. We have to give it year round. And I suspect that the blindness was caused by the heartworm medication, because that's the only medicine. Of course, I don't know that for a fact, but it's the only thing that the dogs got. And it seems awfully strange that both Evil and Gavin went completely blind overnight, just like that. Have the same diagnosis, SARS, but SARS is something that the eye doctors will say when they don't know what caused it, right? Like,
retinas are very sensitive, for sure, to everything. And that's really challenging, especially if you're in a place where you have to give your dog medications frequently, and it's difficult for them to process them.
Karen,
Anyway,
I
thank
don't
you
know if you
again.
mentioned, sorry,
Oh.
Lisa, yeah. I don't know if you mentioned, but there are plenty of vets out there, not necessarily yours, but we've had some puppy owners that they go and they're asking for their test. They want to test their bile acids. And the vet says, but your dog's healthy. There's no reason for that test. There is a reason for the test. It doesn't have to be because you know something's wrong. You just want to screen. But one of our young puppy owners was just told by the vet they wouldn't do it because there's nothing wrong with the puppy or the dog. It's a dog, it's an adult. But you need to work with them or find another vet that does if you're interested and want to screen your dogs. So just wanted to mention
That was my next question, is like, do you have to go
I
to a
wanted to
specialty vet?
answer to that. Can I add something? This is Tammy again. I
Of
think
course.
it's different dog to dog. I'm talking symptoms, different dog to dog and breed to breed, because I can tell you seizures are very common in Yorkies, and they're very young when they start. So the old adage, the dog seems healthy. Yes, I've seen some rather healthy looking Yorkies. Very good friend of mine who has since passed away. She had a on the thin side Yorkie that one of the big things with, I'm just going from the Yorkie side. They tend to be rather picky eaters. They tend to like a food one week, and then the next week they don't like it because their tummies get upset and they get headaches from the bile acids that are floating around in their brains. And so they associate the food with the pain. But I can tell you seizures is one of the things that you see, I think, most common. They also walk around almost like, and I'm talking 16, 18-week-old puppies that can be affected. They walk around like they're drunk, and their blood sugars drop like crazy. So it's difficult to keep their blood sugar levels up because they refuse to eat. So I do think it's very size dependent, breed dependent. I'm not sure which it is, but I can just tell you that Yorkies tend to be, when they have MVD or a shunt, it doesn't matter. They're affected more severely, and generally they do not live to be 12, 15 unless you have the shunt corrected, or they're on the Denamarin and it used to be lactulose. I don't know if they use that in AHTs, but it's generally Denamarin, lactulose, and the one you use for, can't think of it. It's very bitter. And you can use it for Giardia. What is the name of that pill? Oh, well, whatever. But they use that combination, and they've added like the milk thistle has been recently, but the lady that asked about the seizures, it's very common in Yorkies. I just wanted to put that out there.
Thank you.
Yeah, thank you, Tammy. And Lisa, you had started to say something else.
I was just wondering, like, how difficult it is to find a vet to do this. And Ryan answered that a little bit, like you kind of have to push a little bit to get people
Not
to do
always.
this breed.
Yeah, I mean, our vet right away. So we had an amazing vet for years and years, and unfortunately we lost him to suicide. And when we moved to the other vet, is this country vet guy, and we just explained, and he said, sure, no problem. And we don't have to have an appointment. Even I can just take the dog in and they'll just say, oh, the Pingles are coming for serum bile acid test. Doesn't even have to be a dog that they've seen before. So when we first started testing all of the dogs, I mean, I had like all of our puppy owners, like, please bring your dog to the vet on this day. I will pay for the test. Just bring the dog. Just bring the dog. I'll, take care of everything for you. And so these vets, without even examining the dog, were willing to do the test because I explained why. And I think that's the big thing. So I called the vet in Orlando that Ryan is talking about for our pup owner, who they told her no because he was healthy. I spoke to them today, and I explained to the tech why. And the vet tech said, oh, I see. They were not able to articulate that as well. And I will have the vet call you tomorrow and discuss with you, the whys, and I'm sure he will be willing to do the test. So I think it's just a matter of explaining why, and whether it's just because it runs in the breed, or because you just want to know, or because it's part of the health testing that you're doing for breeding stock. Hopefully the vet is willing to do that. It is just a blood draw. Some places, my vet has never heard of it. Well, my answer to that is always, you should probably go to a different vet, because if your vet really does not know what a serum bile acid test is, then that's a problem. You're on mute.
I said
Yeah.
it's not new. Go ahead.
I wanted to say something about the vets. I'm lucky. My vets are very interested in learning about the American Hairless Terrier. They realize that they're not common. Yes, they're a dog, but they do have some unique things that are in the breed that are not run of the mill. And so when I explained to my vet why I wanted to have the SBA done, even though my dogs were healthy, they were very, very accommodating. But I did have a previous vet that, first off, thought the dogs were a genetic flaw and did not understand why we would be perpetuating a genetic flaw. I very kindly said to her before I left, I says, well, and on that note, I thank God every day that this genetic flaw has been perpetuated, because I, for the first time at age 45, was able to have a dog and experience what it's like to live with one in my life. And my life has been enriched ever since. So I say, if your vet is not willing to learn and grow knowledge with a breed that they don't see very often, then they don't need to be your vet.
We tell that to people too, Jojo, and I know a lot of the people here that have poodles. Obviously, the poodle is a very common breed. I don't know where it ranks in popularity at the moment, but the breed is well known, certainly. And I don't know, Michelle, what your experience has been since Gloria started talking about the liver issue in poodles. I don't know. I'm trying to look, but it looks like a lot of the people here are AHT people. And Lisa, so is your breed poodle, Lisa?
Yeah, I have standard poodles. I don't know the origins of the standard poodle that was in my class, and I'm actually I'll probably talk to her about it a little more. But yeah, it just, as soon as she said that, and I'd heard Gloria and Michelle talk about it in a meeting, my ears just pricked up. Like, oh, I need you to come to this meeting. I don't think she did, but I'm going to send her the video afterwards.
Please, and if she has questions, I'm always willing to do my best to answer. And we're also very fortunate that one of our pup owners is also a vet. And so sometimes if people ask me something that I don't know, I ask her. I just tell them, that's a good question. I don't know. Let me ask our puppy owner. She's happy to help out and give an answer. So did you want to add something, Michelle?
I also have standard poodles. So I guess the thing is that there's a lot of people that are inter-variety breeding to get a smaller standard. So I'm concerned about looking at, what that might do down the road.
Well, we definitely appreciate the United Poodle Association's interest, and I think it's amazing that people are willing to listen and learn. And I know the poodle as a whole, one of our pup owners bred poodles for a long time. And she said that, like, say 35 years ago, there were a lot of health issues coming out in poodles, and that the poodle breeders as a whole, most, of course, you're never going to have 100% buy-in by anyone. Most of them sort of banded together and really started doing an outstanding job of trying to improve the breed. So I was really hopeful when I heard that. And my goal is just to help other people not experience what we had to experience, because it was not fun. And Joyce, did you want to add something? I see you're off of mute. Joyce is like, oh, I'm going to turn my camera and microphone off now.
No,
Can I
I'm
add
still,
something about
I'm
that?
still trying to figure this out. Can you hear me now?
We can hear you. We can't see you anymore. We could see you, but now we can't. But
Well, let me see if I can get back.
there
Can
we
you
go.
still hear me?
Yes.
Well, I had just said when you're going to go look for a vet, I typed it out that come with the information in hand, because some of them don't know, and I've had to explain over and over again about the timing has to be accurate, because that always worries me. When I leave my dog there, are they getting the test done at exactly the 2-hour point? So
That's actually a really good point. And something that we do, because we're really spazzy, is we will do the pre-prandial. We will take the dog back to the car. We will feed the dog to make sure that we have controlled the amount. We notice the time that the dog finishes eating. We set a timer. And at 1 hour and 45 minutes, we walk back into the vet's office and we say, this is your 15-minute warning, 15 minutes before the blood needs to be pulled. And then we exit. Like, the dog is still in the car. So the dog is happy and, whatever, not thinking that it's at a vet. It's just a happy dog. And then 5 minutes before the 2-hour exact mark, we walk back in and they say, oh, we can take the dog. And I say, nope. I said, do you have everything set up in the back? Yep. And I'm like, okay, so hold. And then, 3 minutes before, I will hand them the dog, and then they can take the dog in order to draw the blood. Because if they don't do it right and the number isn't right, I don't know, then I have to pay again, so I want to make sure that I have controlled as many variables as I possibly can control. And again, our vet's office is used to us. We've now done a gajillion serum bile acid tests with them, so they know we're a lot crazy.
yeah, well, they kind of think I'm crazy too, but
Sorry, mine froze up. It's still freezing.
what?
Oh, that's
No,
Tammy.
that's okay.
Tammy, you're off of mute. Okay, go ahead, Joyce.
I've taken, I think the last dog I took in, I did just post. And I'm like standing around tapping my foot going, come on, guys, we got to get this done. Like, it's like 2 hours and 10 minutes now before we're getting the test done. So I don't know how to improve them on that. But can you see this little guy over my shoulder? That's Mystic. He's my little guy that is maybe a 32 on bile acids. He stayed here, but he's small. He's not got a good appetite. He likes to be hand fed. Yeah, he's not sick, but I can see that he's suspicious. So every time I have a small one, I'm like, yikes.
Yeah, I know. So we're like that too. It always makes me scared anytime somebody's even a little bit on the smaller side. But
And
yeah,
those
and
are
for the
the
record,
first one. Those are the first ones people ask for, is the small one usually. And you're like,
They
okay,
are.
but be aware.
yeah, so Evil, for the record, was not small. Evil was average size, and actually at the time she might have even been considered a little bit big for the breed. So she was a good sized girl with good bone, great appetite. We had no idea that there was anything wrong with her liver until we went in for that spay and her blood work was bad. So from her behavior, we could not tell that something was not right. So
Yeah. Well, I had a half brother to Evil, and his bile acids were a little bit high. And of course, the AHT people that know me know I pulled all those dogs from the breeding program, but they kind of snuck through, and now he's in the background of practically every dog in the breed now.
but the good news is as we move forward, regardless of the breed, whether it's Yorkie or Poodle or, AHT, it does not matter. But if the breeders are conscientious and try to do the right thing, selecting only normal to normal in an ideal situation, and equivocal, that's truly equivocal. So the dog has been tested more than once to see. Ryan's heart dog is a dog named Emery, and she was equivocal. She was 17 or 19, same as Evil and or Gavin. And we had not retested her, and she was age 5, and we were going to breed her. And so we retested her, and she was abnormal. So she was spayed shortly thereafter. She's perfectly healthy. There's nothing wrong with this dog. But she was never bred, and she will never, ever, well, she can't now, but she was not bred. And yeah, we are glad that we repeated the test so that we did not make a mistake. So normal to normal has really helped to improve our offspring's chances of being normal.
I wanted to add something real quick about the vets. A lot of the reluctance in the beginning I found was because they truly did not know the mechanics of drawing the blood, and that is actually important. The needle gauge needs to be large enough, and we're talking a Yorkie small breed, so they have to get it from the jugular. But the needle gauge needs to be large enough so that they're not lysing the cells, smashing open the cells, because that can interfere with your numbers. The way that it's spun down, they have a very tight protocol, and all the vet has to do is either call Antec, which I have spoken with Antec and IDEX multiple times, but I think that's maybe where some of it is. And the person was it you, Joyce, that said that a puppy owner the vet didn't even want to test him because they quote unquote looked healthy?
No, that wasn't me.
That was us.
Okay, so the opposite is for Yorkies, because it's been so long since we've had it, and it's so prevalent in our breed that you walk in with a Yorkie that even looks at you sideways, the first thing they're doing is a bile acid test on Yorkies. I mean, it is, you go to the emergency clinic here, and the first thing they're going to want to do for a dog that's just got a little bit of gastroenteritis is they're getting a bile acid test. So I just think because it's been so common and so prevalent, because in my opinion only, the Yorkie breeders did not do their due diligence to try to help this breed when they had plenty of time and understanding. Instead, they did the ostrich and buried the head. But like I said, doing the testing for, a Yorkie is one thing, but other breeds, the vet looks at them and says, well, they look okay, they look fine. Well, their symptoms don't seem to be the same. But the big thing is making sure that your vet, if they don't know, all they got to do is call IDEX, and they'll tell them what gauge needle, they'll tell them how long to spin it. They give them all the information. So.
Can I say something?
Yes, Holly. Holly's another Yorkie breeder turned AHT.
I just want to say that I feel very strongly that I'm coming into this. A lot of people said that they health test. The only thing I want to say is that I think it's imperative, whether you're buying a dog for a pet or you're buying a dog for showing, you want to see health tests in person. Like, have them email you the results or ask to contact their vet. Just because they say these are the numbers or this is the number, that's just my humble opinion. Sorry, that's all I wanted to say.
Thanks, Holly. Thanks for joining.
I've been here the whole time.
I know, I'm just saying, thanks for contributing. Thanks for being here. Yeah. Anybody else have any other comments, questions, anything?
Okay, well, we thank you from United Poodle Association for spending the time talking with me beforehand and this hour and a half that you've given us this evening. And thanks for all the participants sharing their experiences. Hopefully, this information will get out to a wider audience.
We hope so. I thank you so much for the opportunity. And yes, thanks to everybody who came and participated and shared. The more people that talk about it, the less likely it is to be a stigma, and the more likely it is that people will do the right thing by the breeds and the people that love their dogs. So thank you all.
Yeah, thank you. And I'm so sorry you had to experience it.
Yeah, it was no bueno. No, and do you know what else we did, Michelle? Which is crazy, and I do not advise this. This is not advised. No. When we got our SBA back, all of our normal dogs, do you know what we did with them? We biopsied the normals. Because I was so shaken to my core by the loss of all those dogs, by the heartbreak, by taking phone call after phone call from the people whose dogs were having all of these issues and dying these horrible deaths. So Lisa, though, if Lisa's still here, I can't see her, but those puppies did have seizures. Ours at our house, we have not seen that, but those evil toggle puppies that died early, they did have seizures per the puppy owner's reports. But taking, those phone calls, it was too much for me. And I told Ryan, I said, we're going to have to get out. I can't do this. I can't do it. So the only way that I could go forward is we literally paid $800 a dog. We put our dogs under anesthesia. We opened their bellies and we biopsied 3 lobes of their liver, and we sent them off for analysis to make sure that they were normal before we would go forward. I do not recommend that insanity. I just simply could not find another way to move forward. I was too traumatized, too afraid. So I at least knew that serum bile acid was normal, biopsy was normal. So these dogs that we were going forward with had normal livers. What happened after that, I've at least done everything and more than I should have done. But yeah, so now at this point, when the dog has a bad serum bile acid like Emery, we will not do ultrasound. We will not do higher level scans. We will not do biopsy. We will just continue to provide her with her liver friendly diet and her milk thistle, and hopefully she will live long and prosper, like her father, who was normal, but also was a son of Rowdy. So, but thank you.
And thank you. Thanks everyone
Thank you.
for coming.
Thank you.
Thanks, Michelle.
Bye.
Bye.
Bye.